All right. Hi, everybody. This is Angelique Beslick, and I am here with the Healthcare Supply Chain Hub in our 30-minute weekly learning bites that we do every single Tuesday at 3:30 Pacific time. And I'm so glad you guys are all here ready for today's topic. So let's just jump in and see what we have going on for today. Our topic today is building a rolling 24-month, or you can even do 12-month initiative calendar that really reclaims control of healthcare contracting. So we're going to go through step by step why building a initiative calendar of some sort will help you with portfolio management, contractual scope creep, and really getting the team adjusted and balanced between value analysis, strategic sourcing and contracting, your operations team, making sure your whole team knows what are we working in advance. And this will also help your stakeholders. So let's just jump into this topic today. I'm super excited. Lots of key takeaways today. So I will say that contract expirations are one of the biggest hidden sources of loss, period. I just really want the team to understand that, because if you allow a contract to expire, it really it opens up a supplier for all kinds of hey, this was expired, so now I can charge you list price. And this could cause chaos and havoc within your supply chain. It also will, remember, put POs on hold, and you could get credit hold if you don't have an updated pricing file. All these things are part of your procure to pay process too, and it just causes lots of havoc. Reactive sourcing kills your leverage, and it slows the team down, and it actually burns people out. And I'm not just talking on the provider side, I'm also talking on the supplier side. For a supplier to have to jump through hoops and quickly get a contract done, that kind of reactive sourcing really kills the morale of everyone involved, especially in strategic relationships. A rolling 12-month or 24-month contracting calendar really transforms everything into predictability. Stakeholders are no longer questioning, like, hey, when are we working on wound care? Hey, when are we working on a spine strategy again? When are we working on this or that? And it also helps with your new product request funnel. Like, when should I be requesting new products for a certain product category? Starting sourcing like 6 to 12 months early is actually where you're going to get real value, because you could then look at product categories that marry different vendors, and you can say to a vendor or supplier strategically, I'm working on this product category and this product category and this product category in the next 6 to 12 months. What could we do all together as a strategic package? Oh, and this is where like value really comes forward with like vendor book of business. Level loading the workload actually prevents burnout and improves outcomes for the team, especially within the value analysis process. Monthly governance is the engine that then keeps that calendar alive, right? So you're going to kind of push that through value analysis. Does this still seem relevant? Strategic sourcing team, what are we looking at for future contracting in these product categories? What does that all look like? It just keeps momentum of that calendar alive. Having that predictability really strengthens your relationships with finance, clinicians, leadership, stakeholders, whatever the contract is with, right? So you got products, equipment, technology, any kind of purchase service or service within your corporate office, like human resources, people and culture, finance, population health, marketing, all those different services contracts. It really strengthens those relationships that you have with all those stakeholder groups. Early alignment actually drives better pricing, better quality, better decisions. You can actually take time and think about a decision, right? If you have time to think about a decision that has to be made, instead of being rushed into a decision and you have to make a decision about a supply or a piece of equipment in 30 days or even 2 weeks, that gets really chaotic. So if you do early alignment and you're pre-planning your initiatives 6, 12 months out, you have time to really think about what that decision looks like and what your sourcing plan really looks like. Most value is one in the preparation of a sourcing event, not the negotiation of. So if you have a lot of time to sit and think about putting that sourcing plan together, and what is our strategy, and what are our scope and requirements that are really important to us as a clinical team, or as even a purchase services team, you can really think about those things ahead of time. You're not feeling so reactive if you only have 2 weeks to get an initiative done. And I think that that's where more value is one. If you guys have taken any of my 7 healthcare supply chain certification modules, you'll know that I actually give you a sourcing plan. And there's a lot on that checklist to do an RFP. You cannot get through that in 30 days. There's a lot of prep work that has to be done. And really starting sourcing 6 to 12 months early really helps you get through that sourcing plan too. So I'm hoping you guys are all going through my certification program. If you don't own your contract calendar, think about it. Your suppliers will, because they're going to be the ones that are telling you, hey, pricing went up because you let your contract expire, or hey, this has to be signed by tomorrow because it's expiring. And you want to kind of have this strategic partnership with your suppliers where you both know the contract is expiring, in 6 months from now. Maybe you should start talking about it now and start talking about your options. And it just kind of makes everyone owners of that contract calendar. So some things to think about. I always call this, and you guys have heard me say it, especially if you're in my training, this is literally portfolio management 101. If you are a contract administrator of any type, strategic sourcing and contracting administration, you need to know how to manage your entire portfolio of contracts. And this is portfolio management 101. All right. So, thinking about why contract expirations are so critical, right? To make sure that we're managing them and why they matter. Expired contracts cause preventable margin loss. If a contract expires and pricing goes back to list price, and it stays at list price until you can get it renewed, right? You've just lost that amount of time in margin loss, right? I also think about what other risks do you have if your contract's expired, but you're still buying the item. I think about like IS or IT contracts where it expired and they shut off your technology. Have you ever had that happen to you? Those are huge risks within your organization. Auto renew terms remove your negotiation leverage. I do not want to see you guys doing auto renew. I know a lot of ISIT vendors do it. I think you've got to get some of that stuff under control, because you want to have a period of time where you are looking at, do I even want to renew this? Is this a redundant contract where I already have another supplier in place for this product category or this service, right? I think that you need the time to review a contract. Now, if you guys have to be forced into an auto renew situation and vendors, you have no control over that. Let's just say you have to do auto renew. You've got to be setting a flag in your ERP system providers that says, hey, 188 days out, look at this contract. It auto renews in 180 days, but start looking at it with your stakeholders to make sure it's exactly how you want it? Or do you need to do a change order? Or does something need to change? Or do you need to do an amendment? Okay. Late renegotiations eliminate competitive tension. And of course, like if there's competitive tension with a supplier and they're really super worried about losing the business, and they wait till the last minute just to say, hey, let's renew, it because they want to just lock that business in, it's not very strategic. That's very transactional. We want to do renegotiations up front as soon as possible, as soon as we know about it, 90 days out, 6 months ahead of time. I know that suppliers, you feel the pressure of competitive tension in that. And they may be questioning you like, hey, should we go with another vendor? We've got time. We've got time to throw this out for RFP. And I know that that gives you tension and it gives you pressure as a supplier. I get it. But if you're a strategic supplier, you're coming in with options to enhance and make that better, or get some more of the book of business and maybe other product categories and enhance it in some way and offer value to the provider side of the fence. You could really become a strategic partner, and then you won't have to worry about losing the business, right? And then the last thing, missed expirations really lead to price drift and missed rebates. Oh my goodness, missed rebates. Of course, you guys know how I feel about rebates. They're not the best thing because you don't get cash up front. You don't get your discount up front. But thinking about if I miss an expiration date, I already said it before, you could go to list price the day after expiration. And from a PO standpoint, you don't want that to happen in your procure to pay process. You want the pricing to stay consistent, and be able to have time to renegotiate that, lock in your pricing before expiration, and boom, you have a new start date of your new renewal. Okay. All right. So the real cost of reactive sourcing, I want you guys to see this. Teams spending the majority of time firefighting expirations, rushing. I don't know how many times the strategic sourcing and contracting person came to me saying, I need this signed by 3 p.m. this afternoon, Angelique, because I'm the signer for our organization. Lots of weekend, late night signatures. I'm like, why? Why is this happening? Especially year end. Why are we not working on those year end expirations? All those contracts expiring December 31st. Why aren't we working them in like September? We feel that rushing our sourcing leads to poor negotiation outcomes. And I'm saying for both sides of the fence. It's not just on the provider side, suppliers too. If you guys feel rushed but you've got to get a contract signed, you're feeling the pressure of your sales leadership team, and maybe you lost something in that negotiation as well. Now, of course, clinicians and any of our stakeholders on the other side of the fence are feeling blindsided by any last minute changes. Maybe they thought that they were going to have a sole source, an entire product category, but because it was so last minute, we had to bring a secondary vendor in, and now they're frustrated by that because they only wanted to go with this vendor. And then the finance team like loses that predictability and budget visibility where they thought maybe that product category was going to stay consistent for another 12 months, but oops, we waited till the last minute to negotiate it, and we had to take a 3 or 5 or even more percent increase because it was last minute. And now the finance team's like, oh my gosh, I have to readjust the books. And now we have a variance and this doesn't look right. And what are we going to do? So there's so many implications of reactive sourcing. Now, when I talk about, this 24-month, maybe even a 12-month, because some people are like, I cannot fathom 24 months ahead, Angelique, a calendar. I personally do a 12-month at the organization I'm at, but a calendar like that, where everyone at your organization knows what initiatives you're working on 12 months ahead of time. If it was 24, that's awesome. You should at least try to do 24 for capital. And that's, Tom Derrick at Open Markets, and I talked about that several weeks ago. But it creates this organization wide visibility of what is happening. No longer will a nurse say, I didn't even know you were working on wound care. Well, yeah, you did 12 months ago. You know, um, I didn't even know you were working on that initiative. I would have loved to be part of it. Well, now, they can be a part of it if they know ahead of time that you're working on something 12 to 24 months ahead of time. And speaking of Tom Derrick, I just saw him join. So, hi, Tom. We were just talking about you. We were talking about having ahead of time at least a 12 to 24-month calendar of your initiatives that you're working, especially on the capital side. I'd love my team to see at least 24 months, if not 5-year calendar of capital ahead of time. But we know that that is almost not possible, but we're all kind of working in this reactive state. We always say that this supports proactive, planned sourcing cycles. If I know that I am working my spine initiatives and some of my PPI initiatives every 2 years or every 3 years, it gets us in a cycle. And it also gets our new product requests in a cycle. And it also gets our cost containment efforts in a cycle. So, hey, no, we remember we always work spine every third July, right? Or we always work trauma every 2 years in December, right? Then the team gets into this cadence of always knowing that's when you request capital for trauma. That's when you request all of your changes and new product requests for trauma. All those things, they kind of have to then meld together and align. And then it builds leverage by starting like sourcing 6 to 12 months early. If I knew everything I'm going to buy from a capital standpoint next fiscal year by December 31st, couldn't I go and talk to those suppliers and say, hey, I know capital wise, I am buying all this stuff from you. Can you give me some kind of a bundle deal? I do that with several of our very strategic suppliers that I work with today. And I love it. And I love them for it. Well, I'm going to say they love me for it because now they have a plan that my organization is going to buy X amount of capital for the entire calendar year. Heck, if we could do that capital wise 24 or 5 years out, that would be even better. But from a supplies standpoint, or even a purchase services standpoint, if I am Joe's window washing and I knew that I had you locked in for 2 years of window washing, and I'm just a little local business, that helps me, so much. And if you told me that at least 6 months ahead of time, I would love to leverage some kind of negotiated deal with you. And then it improves alignment with your clinical and financial stakeholders and all your stakeholders across your whole organization. And from a supplier side, same thing. So I want you guys to feel like there's benefits in knowing what you are working 12, 24 months ahead of time. It is super helpful for a ton of people. And so, what should your calendar include? All contract expirations that are plotted month by month through that time frame. So I'm looking and running a report of all my contracts that are expiring in that 12 months or in that 24 months. And then I'm saying, these are all the contracts that are lumped together by product category. So this is all wound care, this is all spine, this is all let's just say cushions or incontinence or whatever it is. And then I'm saying, hey, what are the high risk, high spend categories? Make sure you highlight those. And then think about like negotiations. And when was the last time we went out for RFP for that product category? Hey, do we have a lot of safety complaints or clinical complaints through our safety system through RL Solutions on that product category? Or hey, does that benchmark poorly? Maybe I want to actually go out for RFP for that category, and it needs to go on our calendar that we're going to go out for RFP. And we really then need to do an evaluation and maybe a tabletop exercise with our clinicians. And we're going to need negotiations and legal and signatures and all these things inside that calendar. And I'm going to plot that out. Like if I knew I'm doing wound care, if I'm doing incontinence, I'm going to say at least 6 months for that project. I might start it in June because all the contracts expire December 31st of next year. And I'm going to plot that out on my calendar that I need 6 months for this initiative. Spine, that might be 8 months or 9 months. And I'm going to plot that out on my calendar in that way. You've got to have a start date, knowing that your end date is your contract expiration month, right? And then think about the workload and categories like light, moderate, heavy cycles. You cannot bog down one of your contract administrators with 18 RFPs all at once. So this is all part of portfolio management of your contracts. You're also going to have to look at workload. Do you have enough capacity on your strategic sourcing and contracting team with your value analysis teams to work all those initiatives? And if you're like, I don't have enough capacity, okay, well, we're going to skip spine this year and we're going to do an RFP for spine the next time it comes up because I'm going to focus on shoulders this year and maybe total joints and a couple other implants. Okay, so that's what the calendar is great for, looking at capacity too. Okay. And then level loading that your team's workload, right? Distributing the sourcing events across all quarters. You do not want within portfolio management all of one contract administrator's contracts expiring all at the same time. I like to make sure those are spread out. And if you have to work with your suppliers and say, hey, can I extend that contract for 90 days or 6 months or a year so that I'm level loading that strategic sourcing and contracting person's workload? That's all part of contract portfolio management. You want to avoid heavy clusters of contract expirations, especially that December 31st cycle. I try to make sure that none of my contracts, if I was managing contract portfolio, none of them expire December 31st. I know a lot of our GPO contracts expire then, so I make sure none of my locals expire then. Assign capacity based on the contract complexity. Of course, I'm sure you guys all have senior contract administrators, junior, maybe associate or whatever, and then just maybe regular. You've got some different titles within there, and assign those complexity rates of contracts between those folks. And then, rotate categories when workload becomes imbalanced. And I always have our associate contract administrators maybe helping on an RFP so that they can kind of get some experience on how to do an RFP. As, succession planning, they get promoted through the ranks to a senior contract administrator someday. They know how to do an RFP from start to finish. And that really helps with morale within your team. So the next thing is like early stakeholder engagement. This is another reason why the calendar is so important. Engaging your clinicians at least 6 months before expiration and aligning your budget expectations with finance early. And then confirming operational and clinical requirements early, especially if you're doing an RFP, at least 6 months before. Because you're trying to put together the RFP questions for your RFP template. And if you don't have all that scope and requirements from all your stakeholders and from finance and clinicians and all these people, you're going to be sunk at trying to send out an RFP 2 weeks before contract expiration. That sounds horrible. And then beginning supplier pre-engagement and information gathering and like a kickoff meeting and what to expect through the RFP. Same thing with your clinicians and your surgeons, and making sure stakeholders know what that RFP cycle looks like, what the milestones look like, timelines, expectations. All that has to be done ahead of time if you're doing an RFP, especially. You can't just sneak up on a clinician and say, boom, surprise, we're doing an RFP tomorrow. And then it will be due on Friday. And then we're signing the contract next Monday. They'll be like, what is happening, right? Okay. And then monthly governance rhythm, holding monthly meetings to review your sourcing progress, not just on the individual initiatives themselves, but on the whole calendar. We actually bring our rolling calendar to our value analysis committee meetings, to any governance meeting. We want to make sure that in our organization, everyone knows the calendar and everyone understands the progress of those initiatives. We love to address barriers like such as data gaps, delays, I can't get a hold of patient outcomes data, whatever it may be. And I need to know, like, to tell finance ahead of time if I'm going to need more capital because now the equipment count is wrong or there's a breakage in between. And finance loves to know stuff ahead of time. So we really want to make sure that we're addressing those type of barriers. We want to track our cycle times, time to execution from the time you start an initiative to the time you finish it. We do not want a runway of 3 years to do an RFP because that is not running to savings or running to benefit of a new contract. That is a turtle pace. And we want to make sure that we're tracking our cycle time, turnaround time of a contract to our savings, to our contract status. If it takes your team 8 months just to renew a contract, and that's not even an RFP, you should probably question what's going on there. It doesn't take 8 months to renew a contract, especially if the terms and conditions are staying about the same. I want you guys to share updates with executive sponsors too on a regular basis. It should be part of your sourcing plan as well. So, thinking about execution and optimization, developing your negotiation strategies for every contract with your stakeholders should be part of your sourcing plan. Like I said, if you are taking my certification program, you guys will get a sourcing plan for free with that. Use your evaluation matrices for objective scoring. I'll be honest, and you guys will see it in my certification program. I redo my evaluation scorecard every single initiative. It does not stay the same because every single initiative has different objectives and different scores and different weights to those things. So make sure you're doing it that way. Track your savings, your cycle times, and your vendor performance on a regular basis through all of these initiatives. And then update your 12 or 24-month calendar continuously. I do ours at my organization every quarter. I update our calendar every quarter. I look at the quarter that dropped off and I add the new quarter on the end. And then I'm making all the changes in the middle of the calendar every single quarter. So, thinking about this quarterly look back and look ahead. So if I made a decision this quarter, it's dropping off of the calendar, but I also want to look at it to make sure it was successful. And I'm going to review that with my value analysis committees and make sure everybody realizes this was the benefit that we promised with it. This is what we're getting. And sometimes people do those look backs 6 or 12 months after as well. But then you're also doing your look ahead, like predicting upcoming risk, capacity issues. We're all dealing with risks nowadays. We need to make sure that on our calendar, we have capacity to do all the RFPs and initiatives that we want to work. Or are we doing a lot more just contract renewals nowadays because we don't have capacity to do a lot of RFPs? Refreshing that sourcing roadmap as conditions change. So you've got to have some flexibility. Like I said, I do that every quarter, but you got to have some flexibility in that. And then making sure that you're sharing your quarterly scorecards with your leadership team. Do they see time to execution to renew a contract, time to execution to do an RFP? Are they looking at new product requests and time to execution there? All your different scorecards that you're looking at through this process. So as you guys know, always do a massive action checklist so you guys can go implement tomorrow. And I want you guys to be doing this, okay? Actually take what I'm saying and go implement this week. That's why I kind of eliminated Thursday Learning Byte so that you guys could do one Learning Byte a week and then go start implementing. But clean and validate all your contract data, including your expirations, terms, risk, and spend. Garbage data in to your contract repository is garbage data out. Okay. If you do not have your contract expirations your dates and everything in your ERP system or your contract management system proper, it's going to be a nightmare, right, to manage. Build and publish some kind of a rolling calendar. 12-month. Hey, if you guys could do 6-month, whatever, do some kind of calendar with some clear milestones and just get started. I don't care if you guys put 5 initiatives on there for the next 6 months. It's something. Level load your sourcing workload across quarters based on complexity, team capacity, portfolio management of your contracts, and then engage your clinicians, finance, stakeholders, service line leaders at least 6 to 12 months ahead of expirations on large initiatives. And I want you guys to be running monthly governance meetings of some sort for your decision making process, whether that's over value analysis or just decision making, and quarterly strategic reviews to stay aligned. Okay. That's all in the checklist. And then, of course, I always give you guys more steps within all those to dos. So, a couple final thoughts. Number one, if you don't own your contract calendar, obviously your suppliers do. And I really want this to be more of a strategic relationship with your suppliers, not transactional. Suppliers, please help to remind your customers to be good strategic partners. And how can you help them? Tell them when you know a contract's coming up for expiration in 6 months from now. Be that good strategic partner. And so I want to remind you guys a couple things real quick. Let me know if you're not getting my emails. I want to make sure you get the replays, the PowerPoints, the massive action checklists. It might be in your spam, but please mark me and my team as safe so that you get all those tools. But I also want to remind you guys that I do have my certification program, 7 modules. These little learning bites are just little tiny blips of some of that training outside of that training. So this is even like more training. But I want you guys to go get certified because it's super important. And I'm working with the International Supply Chain Education Alliance right now on some hopeful accreditation of the program, but it is legitimate and it is good and it's meaty. So go check out my certification program. I want everyone in this country certified in healthcare supply chain management because it's so worth it. So it's good to see everyone today. Please contact me if you have any questions. And I hope you guys have an awesome day. I'm going to see you next Tuesday before Thanksgiving. I know it is a holiday week, but I'm still going to be pumping out some free information for you guys. So I will see you then. I hope you guys have a great rest of your day. Bye, everybody.